This is the heart. First, we'll start with the anatomical position. We are supposed to hold the vessels with our right hand. The left hand is supposed to be a flat palm. The apex is supposed to touch the index finger tip in this manner. This is how we hold in the anatomical position. Now, we'll see the surfaces. This is the anterior surface. It is also called sternocostal surface. This is the inferior surface, also called as diaphragmatic surface. And this is the posterior surface, which is also known as the base. Coming to the vessels, this is the pulmonary trunk, which is giving left and right pulmonary arteries. This is the aorta, which is the arch of aorta. It is giving the three arteries. This is brachiocephalic artery, left carotid artery, left subclavian artery. Further, it goes down as the descending aorta. Over here, this is the superior vena cava, and on the inferior side there is the inferior vena cava. Inferior vena cava. On the posterior side, we see these are the two pulmonary veins of the left side, and these are the two pulmonary veins of the right side. Coming to the compartments, this is the right auricle, this is the left auricle, this is the right ventricle, this is the right atrium, this is the left ventricle. This is the anterior surface. Now on the posterior one, on the inferior surface, this is the right ventricle, and this major portion is the left ventricle. On the posterior surface, the major component is left atrium, and a small part of the right atrium is also seen. Coming to the borders, this is the inferior border, which is seen even on the posterior side. It is the sharpest border. This is the left border, this is the right border, and this is the upper border, which is kind of a circular border. Then we have the grooves and sulcus. First one, this is the anterior interventricular sulcus. It is present on the anterior surface between the two ventricles. This is the posterior interventricular sulcus. It is present between the two ventricles on the inferior surface. Then we have the coronary sulcus or atrioventricular sulcus, which is present between the between the atria and the ventricles on both the sides. It goes like this in the form of a circle, and therefore it is called coronary sulcus. Let's now see the contents of each groove. First is the coronary sulcus. The contents are trunk and circumflex branch of left coronary artery, coronary sinus, right coronary artery, anterior cardiac vein. Then coming to the interventricular sulcus, anterior interventricular sulcus, the contents are anterior interventricular branch of left coronary artery and great cardiac vein. Then coming to the posterior inferior interventricular sulcus, the contents are posterior interventricular branch of coronary artery and middle cardiac vein.